Hey guys, I had a request to talk about do's and don'ts as far as post-op goes. I do want to start off just by saying that everyone's transition is different, everyone's surgery is different, and every surgeon gives different post-op care. So I had Dr. Mandali in Ohio. I am 3 weeks post-op right now. There's other videos on that. However, just a couple of things that I have discovered within these last 3 weeks. Um, the first week, while you are waiting for those drains to be out, do not move your arms. It's kind of a habit to want to take selfies and stuff like that. Do get a selfie stick. I'm not saying it to be funny. I'm being very honest with you. I took a few. It was just very hard. Those drains are very uncomfortable, and your incisions are fresh. So don't do that. Besides that, that's the only thing within that first week. Make sure that you have help. So you do need assistance. As independent as you may think you are, much as I thought I was, you still need someone to be around with you. Your first day all the way up into like today, my 3 weeks of being post-op. The reason for that is in the following. Do check all of your drawers and see if things are out of reach for you, if something is too heavy for you to pull out or push back in. Certain doors, if it's just hard, like a handle, something you gotta kind of jerk on, do test that out around the house. Move things around if you have to. I actually switched a couple of my drawers because I didn't want to reach down low. Everything that I used was kind of literally right in arm's reach for me. So that's another reason why I could be a slightly more independent, because a lot of things were in my own reach. Do check your shower. If you have a removable shower head, please remember you won't be able to reach up to get it. So if you're at home alone and that's something that you want to do, you're going to have to just sit with it being there. If it's down low, it may be too low for you to get. So you just want to watch where it's at, or something like that. If there's a certain speed or pattern that you like, you might want to just have that set for the next like 4 weeks, because reaching up above your head is really a 6-week thing. It's not a 2-day thing. So anything that is over your head that you're going to have to get to, you need to move those down into an area that you'll be able to get access to it. Another thing is, please make sure you have some of these items. Alright, so I have things like Neosporin in here, gloves, just in case, you need that extra barrier in between of washing your hands, or maybe using antibacterial hand sanitizer or something like that. There's surgical dressing. This is the box for it. You use that underneath the drains when you first get them out, in case there's a little bit of leakage going on. I have several different types of non-stick gauze. I got Walgreens. Here's Johnson & Johnson. I think I had CVS at one time. That's for your nipples. You're going to need a lot of those. That's why I have so many different kind. These are the ones that Mandali sent me with. It's just a long strip, and you can cut them to your liking. I also have regular gauze. These are from CVS. I try to use different places where you can get things, just so that people could see, these things are located everywhere for you. But so I have these gauze pads. This is for cleaning, wiping Neosporin off of my finger, or cleaning my other areas using my surgical spray. Let me reach and get here. So this is wound wash. I have this as well to wash my incisions, if I'm in a place where I can't maybe hop in the shower or something like that. Another thing is Dove Sensitive Skin. I use Dial at first, because that's an antibacterial, same thing that I use like on my tattoos and stuff. But I switched over to this at 3 weeks because after a while they do say that the antibacterial can start having a reverse effect. Let me see if there's anything else in here that's really important. A lot of this you guys seen in my other videos about my post-op box. So that's what's in there. You also want to have your Vaseline or whatever you're going to be using to massage your incisions as the tape falls off, and for sure starting at your 3-week mark. Big thing here, so gotta have that. Also, you might want to keep some scissors on the side. That's just, you know, as far as cutting the tape as it starts to fall off. Maybe you need to cut a gauze, cut the non-stick gauze, so that would be handy. I have a little container that I use, so I have everything that I just kind of talked about in here for on the go, in case everybody knows I do travel a lot, so I have it with me. You will also need Advil, ibuprofen, so make sure you do have that handy. A lot of people don't like, especially like trans guys I see, they don't like being on that narcotic of oxycodone or whatever else is being used from your surgeon. So you want to at least switch over to something to help with that swelling, and that's what Advil will do. Check with your doctor to make sure. Again, I am not a medical professional, so everything I'm saying here is just kind of off of my experience of what I got, maybe what other people have told me as well. What else? Also, make sure you have things out of the way. Don't have like this giant box that's going to be in the way of where you're walking. So when you get home, like on your way to the bathroom, try to have all that stuff out of the way. Have a clear path, because you can't lift the box. So also do any of like shipments or any hard work that you need to do at home, like cutting grass and such, before surgery. Because again, you can't do that for a while. Driving has been a question. I'm not driving, and I'm choosing not to until September 1st, if that. It is not a major thing. It's just something that I've chosen not to do. I don't want to stretch my incisions in any way, shape, or form, and I also like to be fully able to avoid an accident if I need to, and I don't know how my body would react to having to jerk quickly or anything along those lines. So I'm waiting until like after that 6-week mark that I know it's okay for me to be doing some type of stretching and moving with my body. Another is clean your vest or your ACE bandage or whatever is being used your first couple of weeks of surgery. Please do wash that. It does get full with blood sometimes if you have a little bit of leakage from the drain, just from, you know, using the cream on your body. It'll get a little gooey and stuff like that. And of course, if you can't move or if you are moving, it'll get a little sweaty. So make sure you wash it or get a new one or something. Like, just keep that clean because you want to keep that whole area clean. Do use antibacterial soap. I talked about that. For at least the first like 2 weeks. That's up to you. If you don't want to use antibacterial, maybe something with sensitive skin, no alcohol, no fragrance, no dye. That's just me. A lot of people switch over to like organic lotions and creams and soaps. Good idea. Do eat healthy. Eating healthy is just in general, but before pre-op and post-op, you want to do that because your body is going to be going off of the nutrition that you put in to be healing yourself. I've been slacking because I haven't had like sweets and stuff in a long time because of working on having a really nice healthy diet for pre-op. So I mean, I'm still there, but I've been snacking lately, which will definitely be ending because I'm hitting 3 weeks, so I really want to make sure that I'm good to go back in the gym. What else? Do get a lot of button-ups or button-downs, however you want to pronounce it. Just because that first week definitely will be irritating with those drains in and getting stuff over your head and nah. Like, have some button up or something like that. And then try to put on a t-shirt after your drains are out. It is okay for you to reach. Andrea, my follow-up nurse, Dr. Mandali's assistant nurse as well, told me it's okay to reach. You're going to want to be reaching outwards, down, a little bit to the side, up, about right here. So that's where I go right now until I'm past my 6 weeks. Then I'll be doing overhead. Do not get anything over 15 pounds. Some surgeons say 10, some say 15. That 5 pound difference, when it comes to that, I don't think it really matters that much. But I don't care if you are Mr. Macho out there. Do not lift anything over 15 pounds over your head. Horrible idea. That will stretch. I have not done it, but I have gotten very close. I have reached on accident and I felt a pull. I have had something slightly over 15 pounds and I can feel the difference in my chest. So please be careful. I immediately set it down and I did not do it. Also, be careful with what type of backpacks you carry. I do understand that it's back to school and stuff like that. You don't want it crossing where your nipple is. My nipple is here. That's a new area from being like right, like in front, and stuff like that. Be careful for that. Also, my incision, as far as double incision goes, comes up here. That's where a backpack strap will come around. I gotta watch this area underneath my armpit here. So test out different backpacks, different bags. You might want to carry a briefcase or something like that. Try that stuff out. Also, there's one more thing that I had wanted to say about bags. Oh, I used a drawstring bag. Those are amazing. I used my FTM magazine drawstring bag that I got at the Philly Health Trans Conference, and those are the bomb as far as like the weight limit that can be in there, like the weight that you would carry. And then like where they go, it's a small strap or string. So that was a plus. Also, be careful around hot stuff because if you drop something or if your chest is out and you're like cooking and there's grease popping, bad idea. Speaking of your chest being out, do allow yourself to get out of your vest or your ace bandage, like when you take a shower and stuff like that. Don't let it be too long. You don't want your nipples to get dry. You don't want those incisions to get too dry. A lot of people believe in this airing out thing. Your nipples are meant to stay moist, so please keep them moist. Showering the first about 5 to 7 days after I got my drains out, I did not shower facing the water. I had the water to my back and let it drip down. After that, so about the last 2 weeks, I have been facing the shower. The way I would shower, I would wash my incision and my nipples, so my chest area, first. Then I would wash my armpit of where the drain hole and stuff was, second. And then I would wash the rest of my body. I didn't want to cross-contaminate anything to my chest. Who knows? I could have had some mud on my leg, or my dogs are always licking on my legs and stuff like that. I wouldn't want to wash that area. Do make sure your hands are always clean anytime you go to your chest. If that's massaging it, if that's cleaning it, whatever. Make sure that these bad boys are clean. Do massage. Your preference. Go ahead and do it. That's pretty much everything that I can think of off the top of my head. I may have missed a couple of things. Feel free to inbox me. Facebook. You can hit me up on Instagram. My business is on Twitter. So let me know if there's any more questions that you guys have as far as post-op care, or any questions about Dr. Mandali, or any questions about top surgery, period. So have a good night, and make sure you watch the rest of my videos.